An estimated 10,000 New Yorkers are living with sickle cell disease. Sickle cell is a genetic blood disorder which triggers chronic and debilitating pain, and it prevents the blood from carrying oxygen throughout the body.
September is National Sickle Cell Disease Awareness Month. This morning we are joined by Ginger Davis, the president of the Sickle Cell Patients Network, and someone we've watched really grown up, put up a courageous fight against the disease. 17-year-old Parker Todd, who of course is the son of our reporter Nicole Johnson. So Ginger and Parker, thank you for being here this morning. Important topic to talk about. Parker, my goodness, I remember when you were just a little kid, now you're a young man. My gosh. Okay, Parker, let me begin with you though, because how are you feeling first and foremost, right? You've really managed to fight this your whole life. So how are you managing with sickle cell?
I'm feeling great, Dan. I can't complain at all. It's really been challenging. It's every day is unpredictable, and I'm just really here taking it day by day as best as I can.
Yeah, when was the last time that you suffered any kind of crisis? Does it get worse for you in the winter?
So, it doesn't. It get worse. It gets worse any time in extreme weather or extreme heat. It really varies. It's really just so unpredictable. One minute I can be hanging out with friends and the next minute I'm in the hospital.
Yeah.
The last time I would say I was really in the hospital was for COVID-19. It was challenging because I was battling COVID-19 and battling sickle cell at the same time. So,
yeah. I've remembered so many times when you talk to your mother about just you being, having a crisis, as they call it, and being in the hospital, but you fought through it every step of the way. And Ginger, let me talk to you, because what are the treatments for sickle cell disease?
Well, for the first time in more than 100 years, we actually have disease-modifying medications made specifically for sickle cell disease. Prior to 2017, when the first medication was approved by the FDA, we had a chemotherapeutic medication called hydroxyurea. Now we have Endari by Emmaus Life Sciences. We have Oxbryta by Global Blood Therapeutics, and Adakveo by Novartis. And all of them do something a little different. Endari rids the body of inflammation, which is the trigger for pain in sickle cell disease. Oxbryta helps to raise the hemoglobin, so that takes care of the anemia part, helps your body to produce more red blood cells. And Adakveo is kind of like think of it like a lubricant. So when you put oil in your car to keep everything moving, and that's what it does for the cells. It keeps the cells lubricated, keeps them from sticking together. So each one has a different mechanism of action, and they have so far been shown to help people live healthier lives and keep people from having crisis and keeping them out of the hospital.
Yeah, but now that there are specialized medications, I'm assuming it's pretty expensive for families to get these treatments.
Well, it depends. People who are employed and have insurance through their jobs are the ones that are having the most difficulty with paying for the insurance because the premiums are very high. However, people who are on Medicaid managed care, they receive prescription assistance from the pharmaceutical companies, so there is help for people to be able to pay. One of them is like $127,000 a year. So people who are working and paying premiums, their premiums can be as high as $9,000.
Wow.
But everybody else, it's $3,000, and that's paid for with a combination of prescription assistance programs.
Yeah, and just for history here, sickle cell is prevalent in African American communities, right? In New York, 89% of babies born with sickle cell disease are in fact black. Not to just make anybody a statistic here. Parker, you're a senior in high school, right? Oh my gosh, I can't believe you're a senior in high school, my gosh. And you've been living with the disease your whole life. So what has been the hardest part for you throughout this?
I would say the hardest part is just, the disease being unpredictable, because like I said earlier, one minute I'll be hanging out with friends and we'll be hanging out after school or whatever it is. And the next minute I'll be in the hospital, and then I'll be fighting to try to catch back up on work or whatever it is. But I really have to thank my teachers. They've always helped me, and they've tried to push me, and
Yeah, and you're not letting anything stop you. You're coming out with your second book.
Yeah.
Yeah, I am. So the second book is a little bit for older audiences, like people who are in high school. I tried to do more of a comic book style. Me and my illustrator have been working very hard this summer, um, taking inspiration from other comic books, and it's gonna be great. I'm gonna have a little preview of it at the Sickle Cell Walk, and I'm really excited to see some of you guys there.
I'm, my gosh, I'm so proud of you, Parker. Seriously, and you
Thank
just
you.
mentioned that walk. So, Ginger, there is a walk for people this weekend, the 24th annual Run Bike Walk in Central Park. We're almost out of time here. What are the details?
Yeah. So we'll be in Center Row in Central Park. So you can enter either from 72nd Street West or 72nd Street East and come into the area near the band shell. We'll be there. WBLS is providing the DJ special from the Special Baby Entertainment will be our MC.
Okay.
We will have speaker Adrian Adams is going to kick off the walk along with performance Punch.
Very nice.
And we'll have a number of legislators and other notable New Yorkers will be there. And I just want to add one thing. Even though African Americans are predominantly affected by sickle cell, we are not the only one.
Yeah.
It's prevalent in Italian descendants, Greeks, Middle Eastern and Mediterranean people, Southern China, and Southeast Asia. So we have a very diverse population here in New York, and it's more than just Black people. And I would like to invite people of other ethnicities that are affected by sickle cell disease and thalassemia to come and join us tomorrow.
Good.
It's going to be a great event. Thank you, Ginger and Parker. Thank you guys both for being with us this morning. We appreciate it.
Thank
Parker,
you.
where is your mom?
Thank you
She's
for
got
having
you right
us.
there.
This is wonderful.
got
She's
you right
here.
there. Of course she is.
She's here.
Nicole's got it. Come on, Nicole. She's like, no, I'm not going on camera.
Come on.
No, suddenly Nicole's camera shy.
There we
There's a
go.
hand.
Yeah, really, you know.
Seriously, love you guys.
Thanks again.